Welcome to Eagle Media. I am Prasad Vannem Reddy, Professor of Neurosurgery. I also do a lot of research on neurosciences, including head injuries, spinal cord injuries, spine fractures, and brain tumors, and recently on electrical stimulation of central nervous system. So today the main topic I am asked to touch about is on head injuries, because recently there were some interesting cases. One was the instance of a child being hit by a motor vehicle, and child was momentarily unconscious and taken to a local primary health care center. The issue about keeping the patient or keeping the person with the head trauma in the hospital has been a long debated topic, because do you really need to keep somebody in the hospital, because hospital care is known to be expensive. May not be here, but everywhere else hospital care involves doctors, paramedical people, technicians, laboratories, and of course class 4 people. So apart from that, to monitor somebody with head injury requires some kind of digital media, like pulse rate monitoring, blood pressure monitoring, respiratory care, and material like that. So this has been debated for almost 40-50 years now, because minor head injury, somebody coming into the hospital, everybody is in confusion whether it's a head injury or not. Because often people walk into local hospitals, or people are brought into a local hospital following a roadside accident, hit by a speeding vehicle, and something like that. And momentary loss of consciousness is something that you need to pay attention to. Sometimes people just panic after injury and they are traumatized psychologically, especially children. So there will be that panic reaction shown in terms of blood pressure changes, pulse rate changes, respiratory changes, and sometimes the pupils of the eye also are reactive. The same thing happened with the child recently. And then when the child was brought into the hospital, she had different kind of pulse rate, like tachycardia, increased pulse rate, and blood pressure was low. And pupils both sides were bigger. This happens because all head injuries are some kind of concussion to the brain has got effect on the entire body. This is called catecholamine surge. Like somebody is running, slowly catecholamine increases. Like adrenaline keeps pumping, then heart rate increases, pulse also increases, blood pressure also increases. Today you will see these changes when somebody does a treadmill or a stress test for the heart. Just to make out if heart can withstand this kind of stress. Same thing you see in the first initial phase of head injury, where brain is momentarily hit. But the good thing about these things is all these changes come down, and then once patient comes out of that panic situation, they will stabilize, and pulse becomes normal, heart rate becomes normal, even pupils come down. Pupils increasing in size is a normal catecholamine response. Like you see a dog racing after you. You start running, or you get a panic attack, or you are scared. There is a fear complex. And these things, same things happen with those minor head injuries also. So most important thing is to observe that child, observe that person for adequate time, usually 2 to 3 hours. When all this catecholamine surge comes down, then patients become normal. The most complex social issue these days is alcohol consumption. Alcohol consumption is not just a social issue, it's a more severe medical issue. Because when somebody who is drunk meets with an accident, things get very complicated. Because you never know that person lost consciousness because of alcohol or because of head injury. These things are very often seen in many hospitals. But some hospitals are equipped with the right kind of evaluation, and most hospitals are not equipped with right kind of evaluation. So if an alcoholic comes with head injury, you never know if that fellow is drunk and then sleeping, or under alcohol influence, or actually brain is damaged and then he is losing consciousness because of head injury. So those cases, you have no other option than keep them in the hospital and observe them and order appropriate scans. Most of the times we count on something called Glasgow Coma Scale. Glasgow Coma Scale is basically about eye opening, talking, and then how you are moving your limbs. If you can follow commands like hold your hand when you are asked to, or if you can move your leg when you are asked to, that means you are conscious. Sometimes same person might require coaxing, like you may have to tap him or ask him repeatedly. That means he has become drowsy. When you see that kind of response, especially in alcoholic, you have to keep the patient in the hospital, and the most relevant test for that fellow is CT scan of the brain. Because a normal concussion, normal patient without consumption of alcohol has got concussion, may be able to come out of the concussion in a few hours and then able to talk to you. But same thing may not happen, because we have there are a lot of reported cases or anecdotes saying that doctor did not see and then patient was kept under observation without CT scan because we thought the patient was under alcohol influence. Next day morning something else was detected and CT scan would show huge clots inside the brain. Those things need to be evaluated carefully, and the only way you have to do is get a CT scan. CT scan may be normal, and people may complain that you are getting the scans without any indication. That's not right. If you start losing patients, same argument is not going to hold right anywhere in the world. So these are a couple of incidences, like children with head injury, very complicated, very complex, because they do not communicate with you like an adult. Adult who is under alcohol influence or in some places under drugs. Drugs are not like something very alien to any country. Drugs are there everywhere. People consume drugs all the time. And then very few countries have strict laws against drug abuse and then the drug trafficking. And then if you are not careful, you might actually get false negatives, false positives and things like that. False negative means the pupillary reaction which I said. It can be caused by many drugs. People take for pain medication like tramadol or morphine and other narcotic analgesia. Those things are not going to be keeping quiet, especially when somebody loses consciousness. They could be lethal also. So you have to keep in mind how to manage a head injury in a child and in an alcoholic, because these two are very complicated issues. Mind it that observation has to be very thorough in these patients. And then even with the slightest doubt, you have to go for further evaluation like CT scan of the brain.
Like and subscribe Eagle Health and Beauty.